This is a plain CT scan of a 22 years old male patient who was driving a motorcycle without a helmet. He met a road traffic accident. Now, this is his second CT scan. First CT scan was done about 3 days ago, just after the accident. Only pneumocephalus was reported. Now, please observe the hemorrhages in the maxillary sinus, both the sphenoidal sinuses. Now, this is a subdural hematoma here, pneumocephalus. Air lucencies are present here along the lower outer surfaces of the left temporal lobe. Now, this is the hemorrhagic contusion here, slightly hyperdense area. This one here. Contusions are also present in the lower part of the left temporal lobe. Now I will show you his bone window. This is the bone window. There are comminuted fractures involving anterior and posterior walls of the maxillary sinus on left side, with significant displacements of bone fragments into left cheek and into the posterior part of the left maxillary sinus. This is the hemorrhage. There is undisplaced fracture of the anterior part of left zygomatic arch. As I trace it up, there is a comminuted fracture of the lateral wall of left orbit. Now please observe this fracture line here, which is passing through the left mastoid, roof and anterior walls of left middle ear cavity and the roof of the condylite fossa for the head of left mandible. Now, as I trace it here, you find the comminuted fracture of the left greater wing of sphenoid, lateral wall of the left sphenoidal sinus. This one here. There's a fracture involving the lesser wing of sphenoid as well, which has involved the lateral wall. This one here. This has involved the lateral wall of the optic canal because the patient had symptoms in left eye as well. Now these are the hemorrhages in the sphenoidal sinus. Now these are the hemorrhages in the left mastoid air cells and the left middle ear cavity. Now the second lesson to be learned is that please do not be satisfied by the findings on left side. Now please come on to the right side. Now there is a fracture here which has involved the right mastoid. This is the fracture line. This is passing through the left mastoid air cells. This has resulted in hemorrhage on right side as well. The patient bled from left ear only. Now this is the fracture line which has passed through the roof of right external auditory canal, and it has involved the anterior wall of the right external auditory canal as well. This one here, it has involved the right condylite fossa. So one should not confide upon the findings on the side of the symptoms. For example, the patient bled from left side, so should not we look for the right side as well, because the fracture and its findings are present on the right side as well. Now this is the coronal scan. Please observe that there is fracture of the floor of the left orbit as well, but there is no entrapment of the inferior rectus muscle. This is the fracture line which has involved lateral wall of left orbit. Anteriorly, this has resulted in diastasis of the left frontozygomatic suture. Now as I scroll it back, now this was the fracture line which I was suggesting has involved the lesser wing of sphenoid and the orbital apex and the lateral wall of the optic canal. Now this is the fracture line here which has involved lateral wall of left sphenoidal sinus.